This meeting is being recorded. Thank you, Miss Zoom. Thank you for listening to this episode of Ask 360. We are on the back of our physiotherapy in-service here on a Monday afternoon, as always. And we're going to do a group answer to this question. We've got osteopath Max Hopes and the rest of the team here. And our question today comes from Midori. And Midori asks, what is the difference between stiffness and tightness? And are these different from pain? This is a great question. So thank you, Midori, for sending this in. And I think it's really relevant. And I think to answer it correctly, I think we should probably start by looking into what these terms mean to clinicians compared to what they mean to the patients and the people experiencing them. When we talk about pain, as clinicians, we think of pain as an uncomfortable or unpleasant experience in response to some sort of threat or perceived threat. In terms of pain and stiffness, in terms of tightness and stiffness, as clinicians, I think that most clinicians would think of stiffness or tightness as being some sort of restriction in range of motion. Now, that restriction might be a muscle restriction, in which case we would usually term that tightness, or a joint restriction, which we would usually term stiffness. Now, that restriction in range of motion may be compared to normative data or population norms. So if we think that most males of 40 years of age may have a straight leg raise of 65 degrees, and someone comes along and they've got a straight leg raise of 40 degrees, then we would potentially say that they've got tight hamstrings, or we may say that they're short hamstrings, or we may attribute it to some other cause. But we're looking there at a range of motion that's different to a population norm. We might also look at range of motion that's restricted compared to that person's opposite side. Right? So if someone has a range of motion of 90 degrees of shoulder rotation on one side, but then they've got only 80 degrees on the other side, then we'd say that maybe they have tightness in terms of their shoulder rotators. Or we might look at that restriction in range of motion specific to that individual. So if that person usually has an ankle knee to wall test, which is a test that we do to measure the ankle range of motion, say that's usually 12 centimeters, and that person comes in and their test is now 11 centimeters, and depending on where they feel it or where we feel the restrictions coming from, we might term that as being a stiff ankle, in stiffness for them. I think the important thing for us is what we consider tightness and stiffness may not be perceivable to the patient. Right? So they come in, we measure their range of motion. We think that they might have tight hamstrings, but they might not know about it at all. And the same thing with the movement through the spine. So they may be very stiff. They might not have much range of motion when they move their spine, but that's normal for them and they don't notice it. When we look at what the patient perceives these terms to mean, I think pain is probably similar. However, I think most individuals will associate pain with some sort of damage to a tissue, and that's quite a normal understanding of pain for most individuals to have. And obviously, it's our job as health professionals to educate people on the science of pain and how pain and why pain is created. But I think most individuals will associate pain as an unpleasant experience. Tightness and stiffness, however, they'll associate with symptoms that don't quite feel right. They might not quite feel the same as the other side. They may have restrictions in range of motion, but it will be restrictions in range of motion that they're aware of. So when they move the leg in a certain direction, it just pulls. It feels a bit more noticeable than it does on the other side. Now, how I would sort of look at that is that what people are experiencing a lot of the time are just two different ends of the same continuum. So if we have I want to say a discomfort continuum, or maybe not even just an awareness continuum, because tightness and stiffness for some people might not even be discomfort. It might just be something that they're aware of that feels different from the other side. So we have an awareness continuum of 0 to 10, 10 being the most excruciating pain imaginable. If we take it down to a 1 or 2, that's maybe what people are associating with tightness and stiffness. So it feels different. They're aware of it. Maybe it's unpleasant. Maybe it's not really worrying to that individual. But once they cross over to a certain threshold, that might be a 3 out of 10 or a 5 out of 10, all of a sudden that awareness or discomfort then becomes pain, and then obviously the severity of the pain is going to be graded within that individual's perception as well. So that would sort of influence the treatment approaches that we take. Anyone want to jump on at this point?
I think that was a good summary, and I think you're what you're touching upon there, where basically like the perception that someone may have of something being stiff or tight, obviously in terms of what they think they need to do in that situation, a lot of the time it's okay, I need to stretch that or mobilize that, and that might be where the way that we would intervene might be a little bit different to what they would instinctively feel like they want to do, if that makes sense.
Yeah, absolutely. I think that, like you said, what people instinctively want to do, if there's excruciating pain, if you're a 10 out of 10 on that awareness continuum, and if you move your back, if you bend forward and it is paralyzingly painful, then you're going to avoid it. Right, the other end, if you don't feel anything, you're going to be moving normally. As you creep along that continuum, I think if we're still at that sort of 1, 2, 3 out of 10 on that scale, people, because they associate it as being tight, because it hasn't crossed over that pain threshold yet, it feels like it's something that just needs to be stretched and needs to be pushed out. And so when, especially with stretching, if you stretch a tight muscle and you do it for long enough and at a certain intensity, you can certainly change your range of motion. We know that chronic stretching studies have showed this. So in a tight muscle, yes, stretching may be an effective strategy. There might be other things that you want to do there as well. But if it is on that discomfort continuum and there's some reason for it being uncomfortable, so if it is an alarm response, which is what pain is, but it's a lower level alarm than pain, and you're pushing into the thing that's causing that alarm, then you're potentially making that alarm worse. I think this is especially prudent in terms of joint stiffness, and I know there's people that have had some stiffness in the knee that if they bend the knee, if they do like a quad stretch, they feel that little bit of stiffness, and it doesn't feel painful. It's just stiff. It's just tight. If you keep pushing into that tightness and stiffness, there's a chance that you may make it worse, and you may just cause that scale to creep up and cross over that pain threshold. Any thoughts on that?
Yeah, no, absolutely. Yeah, I think one of the things obviously is like one of the reasons people feel like that is tightness and stiffness and stuff like that. These are terms that people hear a lot, and there's this kind of social construct where stretching is perceived as something that's healthy and we should all do more of. So people, once they start to feel that low grade sensation, it's like just a heightened awareness around that area of their body, which, like you say, is not quite far enough that spectrum of pain to really register as pain, but there's something there that will be their kind of go-to. And sometimes it can be detrimental, sometimes just won't really have much effect at all, possibly. Like, I think I was actually an example of this. I was thinking this yesterday. I was running and I strained my calf, and basically like halfway through the run, it started to feel like what people would probably describe as tight. But like in my mind, I was thinking, okay, it feels like that, but really there's some type of low grade muscle strain that's already happened there. And then that I took an awkward step a bit later in the run, and then I really felt that strain worsen a lot. And that's kind of a good example of something that I think the type of story that we'd hear a lot in the clinic, and maybe people would stop and take some time to stretch in that situation. It probably just wouldn't have had that much effect if that's what I did. What I should have done is probably stopped at that point, really, and then we kind of managed the load going through the tissues and look to manage that in other ways going forward.
Yeah, I think clinicians are always the worst patients, so it's always the case. So. Yeah, and I think the muscle strain is definitely one. My hamstrings feel tight when I run. That's again indicative more of a low grade strain. It could be a bunch of other things too. I mean, it could be sort of a neural issue. If you've got some tightness in the back of the leg, that may be a sciatic nerve, entrapment or sensitization, which we know that those sort of things will not respond very well to stretching at all, and they're most likely going to make things worse. I think tendon issues as well. I know, Max, you've had a sort of a proximal hamstring tendon up in the past, so where the hamstrings attach onto the top of the pelvis. Tendinopathies, well, tendons in terms of their structure, they're generally not amenable to stretching. If you stretch a tendon, you're often putting it in a position where it's being compressed, and that compression element is sometimes what makes a tendon worse. So again, it may be a slow onset, and a lot of tendinopathy is a gradual onset. So you may just feel that awareness build up, and it just feels like something that needs to be pulled and pushed or massaged out. So people will try that stretching, and it can flare things up. So there's a few examples there of how stretching can potentially be harmful. I think also we talked, I think, in the last group episode about posture and how strengthening of postural muscles, or what we perceive as muscles that help our endurance with sitting and computer-based tasks and things like that. Strengthening of those muscles can help with that sensation of tightness. People, if they're in front of the computer for a long period of time, they might feel some tightness in the shoulders and the upper back. Now, this may be referred from the neck, which is why it's always important to get it assessed properly, but it may just be that those muscles are being overworked because they don't have the endurance and the capacity to work for long periods of time. So stretching those muscles isn't really going to help. And if anything, if you do prolonged stretching, you increase the range of motion of those muscles, they're now having to work harder because they're working at a longer length. And so that, again, could potentially make things worse. I think this is when I went through the Czech Institute, they used to talk about the difference between a muscle being tight and a muscle being taut. Just a couple of letters difference there, but it's a very different sort of concept. One is a true sort of range of motion restriction. The other is that it just is working too hard. I think the hamstrings are a big one we see there as well. I know most people will come in saying, actually, not so most people that don't have tight hamstrings will come in saying how tight their hamstrings are. Someone comes in saying they've got like a 45-degree straight leg raise. They usually don't really comment. They just lift their leg up. No, it doesn't go any further than that. Okay, fine. Not really too concerned about it. Then you get the yogi who comes in. They're pulling their knee in towards their chest. It's like, oh, I'm so tight. Well, you're not. You've got a lot of range of motion there. Your hamstrings are feeling sore. Again, it's just that step along the awareness continuum. And that soreness, it might be because of a lack of strength in the area. You're doing more than that muscle is capable of, or it might be some tightness in the other area. So often, if you've got tightness in your hip flexors, then that may be causing the hamstrings to work a little harder, or maybe you've got some decreased capacity through other muscles that perform the same or contribute to the same movement, like the glutes. I think that it's important to understand that difference, because if you sort of keep pushing stretching and self-massage and things like that, now these things can be beneficial when used in the right way, but if we're just going after what feels like a tight muscle or a stiff area and doing the inappropriate interventions, then we can actually be making things worse. Any other thoughts on that?
Just last one. Just to summarize a bit on kind of what you've already said, I guess, but like a lot of the go-tos these days when people come in and they present saying they've got tight muscle or whatever it might be, they'll expect us to give stretches, but we'll go the other way and we'll give them strengthening exercises sometimes for that reason, for that region. And that can seem a bit counterintuitive to people, but I just try to explain it as like we're trying to build the tolerance and capacity of that area so that it can handle more, and you don't end up feeling that sensation because it's a much more resilient structure. Yeah. So that can seem a bit counterintuitive to people sometimes, but there's good reasoning behind it.
Yeah, for sure. Okay, perfect. Well, I hope that has been helpful, Midori. If you do have these areas, people that are coming up that are feeling a little bit different to how they usually feel, that you may perceive as being tight or stiff, please. You consult with a medical practitioner or health practitioner, so that we can accurately diagnose what's going on and make sure that we get you on the right treatment path. So thanks again for your question. Please, if you've got any questions, please send them in, and we'll look forward to seeing you on the next episode. Thank you.